This means that we will now start with the first panel session, the first session of discussion. I'm excited about it because it's simply named Women and Gambling. And this could mean anything. What it means, you will see in a minute. First of all, I'm so happy to introduce your moderator, Mrs. Christina Golna. She has the Policy Change and Management Consulting of Innos Limited in Cyprus. But probably you will tell us more about it, what it means, and what the topic is all about. And you will definitely introduce the speakers, and I'm happy to call them up to the stage right now. The floor is yours, and we will see what we can expect now.
Thank you. Can you hear me? Thank you, Chair. Welcome, ladies and gentlemen. It's a surprise that we are the first to go, but here we are. It is a pleasure and a sheer honor to be moderating this roundtable discussion on women and gambling. Very recent data confirm that women and the rate of their participation in gambling is approximately similar to that of men. And the number of women that are faced with gambling-related disorder and challenges is growing rapidly. Only very recently, a paper published in The Guardian confirmed that in the UK, over the past 5 years, the number of women facing gambling-related challenges more than doubled. And now it is estimated that up to 1 million women are faced with gambling-related disorders and harm, yet only 1/3 of them would come forward and seek help because of stigma. So sex, being a female person, is critical in identifying the right way to approach these women and bring them towards care and support. It is obviously not the only factor. It is combined with other clinical and socio-demographic factors. It is related to the stigma that as a society and as people have, and it starts very early, from the first formative years of life. Together with me to discuss these challenges are illustrious speakers, and I would like you to ask you to join me in welcoming them. First, I will ask Dr. Fulvia Prever. She is the Scientific Director of the Women and Gambling Project in Milan, Italy. Obviously, Dr. Wardley is not here with us, and we wish her a speedy recovery. I would ask Professor Panayiotou, Georgia Panayiotou from the University of Cyprus. She is a professor of clinical psychology, to join us here. And Ms. Andrea Wöhr from the Gambling Research Center at the University of Hohenheim in Germany. Welcome. So if I may kick off with setting the scene of how this is all developed, I would like to start with you, Dr. Prever, and I've read your and your colleagues' impressive and groundbreaking work on clustering women seeking treatment and to make sure that we target our prevention and public health approaches. And I would like to ask you kindly to provide us a bit of a background on the factors that differentiate men from women, and even within women, what are the critical factors that make a difference on how these women understand gambling and develop gambling disorders.
So first of all, thank you so much for the invitation. I'm very happy that in this period of time while you are thinking about to develop responsible gambling, you really thought about women, because this is not so obvious, not in Europe, nor in Italy, nor in all over the world, as the book we made all together with many clinicians, Heather Wardle included, Andrea Wöhr, and many others, shows, because let's just make a small step ahead. As we have seen during the pandemic, I don't know here in Greece, but in Italy, for example, during pandemic, women were the majority of the health workers in Italy, like the 66%. That means that women had a very hard burden just to have all what they have to take care at home, the caring of children, caring of elderly people, caring of sick people, more the work, and the majority of them would work even in a sanitary field. So this, if necessary, would show us that the women's health is very, very important to preserve and to take care of. And as we know, gender approach is widely recognized in the health, in health, physical health, to be fundamental in prevention, treatment program, and diagnosis. We know, for example, as a cardiology, diabetics, that women has different kind of symptoms when they have this kind of illness, and sometimes underestimated because you are not addressed to the right way. We know that we react differently to medical cures and medical treatments. So why not the same thinking is not on mental health and on addiction? Why gender approach is so, always we talk about this, but they don't really deserve a real approach in our treatment, in our program of prevention and diagnosis too, and harm reduction. I think that with Heather Wardle, just before pandemic, when we were in Tokyo, I presented a work we did together about why gambling is gendered, and it is, and which are the 10 reasons that Horton, which is the director of Lancet journal, said that there are 10 reasons why gambling is unseen, and women gambling unseen is invisible, and any specific approach dedicated to women is not supported and enhanced and promoted. And most of the reason has to do with the bias that stigma and has in the entire society and within women themselves, because stigma is not just a social factor, it's something that you internalize and as guilty feelings, and women carry on in their life and prevent them generally to ask for help even when they need it. We have women gamblers that are gambling, as you say, more and more when they're going on, but they don't ask for help, not only in Italy, they don't ask for help in any other countries. It's very difficult for them. Why do they do it? Because there is a kind of barriers that they encounter when they look for services, addiction services that treat gambling. The thing about stigma, we can say, for example, of a woman that is gambling, you say she is starving her children. You will never say that of a man who gambles. So that gives you the idea of being a mother, a good mother or a bad mother, is something very connected with the stigma and the reason they didn't come to a service, if you don't think about it.
Absolutely. So if I may pick up just for a minute and pass the ball to Andrea. She's done amazing work on stigma and conceptions and preconceptions and misconceptions of both the general population and subpopulations and gamblers themselves on gambling disorders. Would you say that that stigma within healthcare, within the health services and also outside in the society is affecting differently women than men? From your research, obviously.
Thank you for the questions. First of all, I want to thank everybody for being here and for giving importance to the topic of women in gambling and to stigmatization, which is rarely found in such a conference with such international participation and strong support from government and everything. And yes, I do think that stigmatization affects female gamblers differently from male gamblers because, as Fulvia said, gambling is still very much of a gendered activity. You'd accept gambling and also gambling disorder probably more from a male gambler than a female gambler because because of the traditional gender roles that are still somehow present in our lives, and stigmatization is a very, as you mentioned, it's probably the number one treatment barrier because people who fear stigmatization, they don't come forward to seek help. They tend to hide their problems, and this is best done by not talking to other persons, by hiding the problems, withdrawing from friends and relatives and workmates, and this leads to an increasing isolation, and this isolation also makes people more vulnerable to internalize those stigmatizing attitudes and thoughts. And yes, I think it's even more. It's a problem for both sexes, but it's probably more so for females because, as we said, it is still in our minds that gambling and gambling disorder is much of a male issue, which is not. And I also read the article mentioned in The Guardian that said that in Cyprus the participation of female gamblers is rising, and we need to have more research on that. We need not only to know that the numbers are rising, we also need to know who these gamblers are. Are they young ones? Are they middle-aged ones? Are they old ones? Because then we should address them accordingly. We address a teenager differently to a person my age, 50 plus, or someone 60 plus. And we'd also need to know what kind of games they were playing. Were they into strategic games, which are supposed to be more risky, or are they playing other games, speedy games or not speedy games? If we want to take the right measures, we need more information, definitely.
You will be very pleased to know that the National Betting Authority is prioritizing a project on women, which is looking exactly on balancing the two genders and bringing in research-related questions, exactly as you said, to make sure that in everything they do, they sort of meta-analyze according to gender as well. But going back to what you said about the traditional roles and the difference between women and men, I would like to ask Georgia to help us here a bit understand how are these preconceptions and misconceptions and gender differences shaped from very early on, and what can we do to empower these women that are raised in a different way to come forward, face their challenges, and become ready to accept or seek help and support.
Okay, thank you, and thank you all for having me on this panel as well. I don't consider myself a gambling expert. I have been working in the gambling research area due to the support of the National Gambling Authority, which got me to merge my interest in emotions and psychopathology with gambling. So yeah, I agree that women in gambling is an important thing to study, and to study in a lot of detail and in a lot of levels, because for any sort of problematic behavior, it's important to understand the function, why it's being done, and why it's maintained. Because if something is not fulfilling a role and a function, it tends to not continue. So why would a woman, did I lose my sound?
Went away? Yeah.
Can you hear me?
No.
No?
Yeah.
Now?
Now?
Yeah, better.
Try to speak.
Yeah? No, there's something not connected. Yeah? Now you can hear me. Great, thank you. So I was saying that we need to understand the function that gambling might play in the lives of either young women, teenage women, middle-aged women, and older women, and see the social context that might not allow for healthier alternatives to fill their lives. So one of the things we know is that, for example, in older ages, gambling may function as a way of socializing, of finding friends, of meeting people. My father doesn't gamble, but he often used to go to gambling places because that was a place to watch games,
Football, yeah.
to watch the match, to have a coffee, and so forth. If a woman goes to the same venue, it probably means that we don't really offer a lot of other venues for them to accomplish these needs. So loneliness, isolation, being trapped into the mother and housemaker role for a lot of women, without a way to find people to share some interest, to go out and so forth, is a major risk factor. And that's something that as a society we need to address. Now, beyond that, of course, there's stigma within seeking help as well. It's a gendered area. It's a male stereotype area to have those kinds of problems. It's much more expected that women have other kinds of difficulties, depression, anxiety, emotional difficulties. So I can understand why it would be very embarrassing and very difficult for a woman to actually go and seek help for this specific problem. However, we also know that oftentimes in women, the problematic levels of gambling happen after a lot of these other problems, after a bout of maybe depression or increased anxiety. So this, I think, would allow practitioners, clinicians who have contact with women within the health system to ask the critical questions even before the woman herself presents these difficulties. I think we need to train the clinicians We need to train the medical professionals to ask the right questions beforehand so that the problem is
Which is a perfect point to invite Fulvia to provide us with some background of what they are doing in Italy, because essentially, and the president of the National Betting Authority just announced it, they are working on a very integrated proposal about bringing this public health approach to gambling and safer gambling into life, and this includes the general health services and how we can go through all the elements of public health, from prevention, screening, identifying, linking to care and treatment and support, going forward to rehabilitation and empowerment. So how do you do it in Italy, and what can we learn from you?
Yeah. Thank you for this question. Yeah, I was wondering how you do in Cyprus, but anyway, for sure, in Italy, I belong to the Italian national health system since 38 years. So we have been working together with the practitioner, together as an addiction clinic. I was working addiction clinic, but even in a family therapy center, and we were working together with other center of the health, national health system, as family counseling places, family doctors, and psychiatric clinic, just to interconnect the possibility of intercept the addiction problem in general and the gambling problem in our parkour. What we saw anyway, that according to the problem of how to detect gambling problem in women at a certain, at the first, because we see that for women this is a major problem, because the time that they start gambling and the time they get to a problem gambling is very, very short, which is called the telescopic effect. Now there is an increasing, which is normally even in the addiction field, but in gambling it's even more evident, as we think, basically because of the low income that women have, that brings them more easily to the desperation point. So this increasing so rapidly puts us to face this problem. We have to intercept the problem very, very quickly and to make very quick intervention, because if not, we lose. The timing is very important. And according to this, we say that just starting from that diagnosis, we have seen in the old book already, Gambling Disorder in Women, but in the new one now, Behavior Addiction, that in all the addiction fields, all the behavior addiction, not just gambling, the diagnosis should be reviewed, because what are the factors that gives harms to women are not the same for men. For example, we use this SOGS, the Canadian index for gambling, but this Canadian was made at the Custer time on American veterans in the war, were gambling, were all male. So we should think if these items really fits on women harms too, that really describe why women are suffering for gambling, for example. And starting from this point, we can understand why women gambling is often underestimated. And the other problem is that we don't see women. We don't see women asking for help. And if we don't see them, research is not interested in them, because if you don't see a problem, you think the problem is not existing. So that's why I think you have really to pay a lot of attention on how to intercept female in general population, even in their healthy, let's say, life, a normal life, to see which are the fragile, the vulnerable points that can lead them to a gambling attitude. And what we were saying was very important, what the society offers to them just to feel the emptiness. There are many reasons that women are gambling, what we say, specific women. One of them is, for example, coping about past or present violent situation, which is something very different from men. And gambling is a very way of coping. It's something that makes you not feel anywhere the harm, not think for a while, just be in the bubble. That's why women describe themselves having kind of trance. So something which is very useful in some sense to stay, to feel better, but then it gets the other way around. Or to compensate social isolation, to avoid to feel anxiety and depression, and there's a means to escape, to be a mood modulator, fighting loneliness. Another thing very important is a revenge. For women, gambling is often a way to have their revenge in a relationship which is dysfunctional, and they don't have another way to tell it. It's something like in Italy you say, I'll make you pay for it. Money is there, and gambling is just a way to make you pay for it. Or even to compensate some lack, a lack of emotional, economic loss, and even health loss, sometimes physical handicap, Parkinson, other disease. Even to experience deficient of erotic dimension. This is something we have seen in even older women. We have mainly in Italy, women we see gambling are older women, let's say from 45 on, not younger women, not so much. And my age, which is 60, 63, is the age where they gamble more on physical land-based gambling way. Because in Italy and in all Mediterranean countries like Spain, like France, land-based gambling is better, is more used, like when you see in Sweden, in UK, so it's online gambling, and maybe we will go after the pandemic in this direction, but now we're not. And these old, let's say, ladies of the middle age, and when they have this even need to feel more alive, to feel more, and often if they had the violence in their past life, the erotic dimension in the relationship is missing, and we see that gambling is something that can help them in this direction. But on the other side, it gives you more a guilty feeling and inside to you, and which is different to recover.
So if I may stop you there for 1 minute and pass the ball to Andrea. So these are the triggers, let's say, or the behaviors that maybe push women, towards gambling or unsafe gambling-related behaviors. Now, if we get back to the practical stuff, and you are speaking to an authority that is very keen to make sure that they do it right, and they want to do it from the start. So one bit that we are keeping from your previous intervention was that we need to focus on research and make sure that whatever we do is evidence-based. Now, in terms of how we move with introducing not just the research bit, but the actual intervention bit in women, where would you suppose we start? Where would you propose we start, given your experience?
Visibility, because I think if you close your eyes and think of gambler or person with gambling disorder, what springs into your mind is a male person, but it's not an exclusively male problem, and it would make feel women less exotic if it was more into the public minds that gambling and gambling disorder can be both male and can apply to both males and females. About research, it is not easy to research stigmatization because stigmatization is also, it has this positive side. It's not only negative. You want, by stigmatizing a person, you want a person to make the behavior change. You want to say, hey, it's not okay what you do. You're you're not my partner anymore. You're not like the partner, the person you've been before. Please change and come back. So I'm a bit mixed about attaching that only negative label to stigmatization, which of course, if it impedes people to come forward and look for treatment, it is. We have been conducting a study on stigmatization with males and females, and a vignette study where we described a case of a person who was neglecting studies and relationships. And we changed the names and asked students to rate whether they found that these persons were more reliable or less reliable. But unfortunately, the results were a bit mixed. There was a slight tendency towards stigmatizing females more than male gamblers. But as I said, it was not as clear as we had hoped it to be. So we'll probably repeat that study.
But it would also be a question of knowledge, right? And a question of what we know, what we understand gambling and gambling disorders are, and how early we learn that, and how we integrate that into our overall approach to both gender issues, but also non-gender issues that are related to gambling.
Yeah. Okay, I'm going to diverge a little bit here, if I may, and leave the gender issue aside and talk about prevention in general. Because the risk factors that are involved in gambling, in other addictions, and in some other forms of mental health problems sometimes are common. It was mentioned before that gambling is often done, especially by women, for purposes of escape or coping with a lot of kinds of many different difficulties. And indeed, women are at high risk because they do face these difficulties more. They're more likely to be poor. They're more likely to be exposed to a lot of kinds of stressors, like taking care of sick children and sick parents and poor relationships. They're more likely to have experienced severe trauma growing up, sexual trauma. So yes, they do have more risks that make them vulnerable to mental health problems that sometimes then are also associated with addictions, including gambling. But the problem here is that people in general may lack better ways of coping, healthier ways of coping, both men and women. And indeed, in our own research, we find that using gambling to escape and having poor emotion regulation skills, abilities to regulate difficult emotions, both for men and women, seem to be a very significant risk factor. In fact, we find that compared to other addictions, emotion regulation difficulties are a stronger predictor of gambling than any other form of addiction, even though we knew from the addictions literature that this was a problem. So if we're going to take a public health perspective, a prevention perspective, we think that it's important to start to incorporate self-regulation, emotion regulation, general skills, psychological skills training early on. We're running some projects trying to find ways to make this as a compulsory training within higher education, within colleges and universities, rather than selective or elective education, because everybody has pressures to do other things first. So that those kinds of skills are left behind. But even more, I think eventually this should become public health prevention within the school system from early on. Because these sorts of skills, being able to find healthy ways to express your emotions, finding healthy ways to seek help rather than cry for help through unhealthy ways, finding healthy ways to express your needs to others. These are important skills that prevent gambling, that prevent other addictions, that prevent depression, that make people into better citizens and more participatory citizens. So they are sort of a baseline that we all need to kind of reach to become healthy people in society. So I believe in primary prevention as early on as possible and helping everybody to develop a baseline of healthy coping skills.
But I was about to
add something just about this is very important. In Italy, we do, in this period of time, these last years, we have a lot of program in the primary school just for children, starting from not on gambling, but starting from the idea of chance games and competition game and the collaboration game. So we do something with them, we play together, but they know, they have clear the difference, they have so clear even the connection between chance and gambling. They know it by their family, they know because they see it happening. And so when we find the opposition of the school saying, no, we cannot talk about gambling with, let's say, 8 years old guys, first of all, they know more than us how things are working, scratch card, all this kind, where they can find it, or what the school. Second, it's very, very important to have them face the problem. If you want to have a bicycle, would it better to win in a race like with your how can I bowl with the bowling? No, I can say train myself and be better and better and better in a competition, or should I have it by chance on a chance game? So this is very important, a level to work in. And on the research, I want to add one thing. I think for women, research should be, if you are thinking about this, should be especially on a qualitative level. It's universally now agreed, even from Hinge Breen in Australia and us in the book, that quantitative research says little about women really needs and problem about gambling, while qualitative gives you a lot of input. That's what we do. Yeah, that's what we do as clinician. I'm a clinician, not a researcher, but I work with a lot of researchers like Mark Potenza and others. But it's good that you can go inside and have deep interview with women and then discover topics that then can help research to understand better.
So before I open the floor to questions, because apparently there are some questions for the panel, I would like to kindly invite all our panelists to to just very briefly, in 2 sentences, tell us what would you propose we start with. So from with regards to gender, right, with regards to women and gambling, so what should be our priorities based on your experience, and as briefly as possible, and I will open the floor to questions. So we're giving you the National Betting Authority for a day, and we're asking you to do something about women and gambling. What is your first decision? Obviously, we don't know all the facts, but let's say impulsively, what would you say? Where would you start?
We recently have did a lot of work in finding the new settings and new way to get close to women. For example, hairdresser advertising. See, hairdresser is the place where any woman goes, and we made the project just to have some announcement and some information in the hairdresser, which is the place where women go and talk about herself and talk about without any problem of stigma, any problem. So we thought that this was for example, a good place to reach women and to start to talk with them, to give them indication where they could find some help, a place to talk about their gambling problem.
Andrea?
As was said before, a combination of qualitative and quantitative research, and we also need to be clear about what we can attribute to the biological sex and to gender and societal and cultural roles. We should be very precise in our works so we can deduct the right conclusions from it.
Georgia?
Yeah, 3 things. I would agree on the idea of very precise questions in our research so that we don't overgeneralize and over-stigmatize. What I said before about universal prevention for all boys and girls together, for everybody, at younger age, to help them develop awareness of why they do things and their values in life, of what they want to do with themselves. And also good education for the health professionals in general, including mental health professionals, to identify people who are at risk and women who are at risk, and to ask the right questions, because the best way to get information from people is to ask them.
Yeah, to ask.
And also probably a very clear pathway of linkage to treatment and care and support, because if you identify someone and you can't channel them through the healthcare system to get the support they need, it would be disheartening at the end, and it won't inspire other people to follow the paradigm. So I'm opening the floor to questions. I understand there are questions for the speakers. Anyone? I've got a note here that says you've got questions. So
Maybe on the online system.
Sorry? I don't know. Is it the... there it is. Sorry. Fulvia, if you were to interact with a female whom you suspect you may have issues with gambling, would this be different to an interaction with a male?
Yes. Surely. If I interact with a woman, the first thing I would have her just tell me and talk about her life and her family life, her relationship. If we see, I lead a women group, a women gambling group with women with gambling problem within 12 years. Women never talk about gambling when they come there. They talk about relationship. They talk about their dysfunctional relationship. They talk about how do they feel, sometimes violence issue, which is something which is very, very important in their anamnesis to talk, to help them take out. So I think you have to it's better if they find a female setting where to talk. So for me, it's easier. And have them talk about how do they feel inside, not about gambling. So it would be different. A male would bring me, I see males gambler too, but would bring just different kind of question, and they would like to have like kind of indication of what to do, the steps, like cognitive behavior therapy, let's say. A woman would just need to talk about herself and her life. And I would have to follow this path before going under and take this problem of gambling out.
And this is probably a good point to identify not only if she has gambling disorder, but if she has other comorbidities that may
Sometimes
impact.
there are, Sometimes there are other comorbidities, as you say. Some other times it's just that they impacted gambling in a difficult period of their life, of a physiological difficulty, the one we all have, separation, loss of work, children going away from the... I mean, just a physiological step of menopause. So a turning point of your life where you need to help, support, and you find gambling instead of other things.
Is there another question? Any questions?
Can I add something to,
Yeah,
to
sure,
this
of
question?
course.
Yeah, I agree that getting somebody to talk about their current situation and what may be going on for them is very important. I guess maybe a difference between men and women with regards to this is that women find it easier to talk about other things, at least about relationships, about emotions, about difficulties in life. Men might not find it easy to even talk about those things. So sometimes the differences we find epidemiologically in terms of emotional difficulties or stress and so forth between men and women are a bit artificial because men might turn to addictions before they even acknowledge they have any other kinds of emotional difficulties. So with women, it might be easier to start by talking. With men, you might have to educate them to be talking.
To open up.
To open up. Or find even more creative ways to engage them and get them to even get to some sort of treatment or some sort of support system so they can start talking.
Completely agree, but the thing is that I see men be more helped by like this cognitive behavior therapy, just having steps. They try to have instruction not to talk about themselves. But for women, what is underneath, it's true that they like to talk more. It's easier for them to talk, but not so much to talk, for example, in a mixed group. They have to be in a female environment. So this is something we have to take into account. We had mixed group where women didn't talk about themselves. They couldn't, because many of the issues they have are very delicate, intimate issue, like a sexual relationship, and it's not easy to talk about. And often this is one of the points of their addiction.
So, Chair, back to you.
Thank you very much. That was a really, really exciting discussion. And I think it's always interesting to listen if women talk with women about women. That's what happened. Thank you so much. And thank you for being on time, of course.